All right, POTS and orthostatic hypotension. They are definitely some interesting conditions. So basically, I don't know too much about it, but this is kind of my experience with it. So for POTS, it's usually where, like, if you're going from, like, if you're changing your position, so like going laying down or sitting to standing, your heart rate will typically jump 40 or more beats. So, I think the normal heart rate range is like 60 to 100 or something like that. I think it obviously depends on your age and all that, but so for me, before I was put on certain medications to help manage it, my heart rate when standing would go up to about like 120 plus. So there were times where my heart rate got up to like 150 just while standing, doing basic things like brushing my teeth, brushing my hair, taking a shower, just certain things like that. There are some people with POTS that their heart rate will go even higher. I don't know how you all do it. That is rough. But yeah, 150 is not great either. But yeah, so that's kind of where my heart rate was typically at when just standing, not even doing like exercise or anything like that. And no, this isn't just, oh, you're not conditioned enough. Like, sure, I could always be more conditioned, but your heart rate should not be jumping that high when just standing. So yeah, something else that goes along with that is sometimes whenever I stand up, my vision will like go black for a few seconds, and I have to like just take a second and be like, okay, that's why you're like, I think supposed to, sit up a little bit more gradual, not as fast. But who's got time for that? I don't. Anyway, so with that, there's also whenever you stand up, you might get dizzy, or some people in severe cases will actually just pass out. So for me, I also possibly have orthostatic hypotension. My cardiologist isn't really sure if I have POTS or orthostatic hypotension. There are definitely differences between the two. The main difference is for orthostatic hypotension. So whenever you stand up, your blood pressure will drop. So I haven't really noticed huge drops for me. So I don't really think I fit the criteria completely for that, but I could be wrong. Again, I'm not a doctor. But anyway, I do feel like that might be more of the reason why I've had some issues with passing out or almost passing out at some times, but those times usually only happen after like procedures or surgeries, weirdly enough. I don't know if it's just my body's response to the anesthesia or what, I don't know, maybe dehydration. I could always be drinking more water. It is what it is. But so when it comes to that, I guess I'll kind of go through a couple of procedures that I've noticed these issues happening with. And if you do have POTS or either orthostatic hypotension, and there's also orthostatic hypertension, so that's where your blood pressure would go up when standing or changing positions, whatever. If you have any of these conditions and you do have a procedure or surgery coming up, please let your nurses and doctors know that you do have this condition, because that will help them know more of how to handle the situation, because maybe you need more fluids, because fluids are huge when it comes to these conditions. You need like more like sodium, electrolytes, all that kind of stuff. But anyway, so basically, for these different procedures and tests that I've had, I first noticed it, I think, with my wisdom teeth. Anyway, I got all 4 of my wisdom teeth removed, and I think it was a few hours after the procedure, I definitely felt it coming on. I called my mom, and she came in and was able to catch me when I passed out. That was the first time I've ever really passed out after any kind of procedure, because I haven't had that many. Another thing that I've noticed, or another procedure that I noticed this happen with, was a colonoscopy. I guess it was colonoscopy and endoscopy. I've had 2 colonoscopies before. The first time it didn't happen. I was also a little bit younger, so maybe this condition didn't really form until a little bit later. But thankfully this happened in the hospital because of an ER visit with the nutcracker syndrome. Actually, it was just last year. But I think it was the day right after the scopes, I had gone to the restroom. It was like I had just woken up pretty much. And so the nurse came in, got my vitals, whatever, and then I went to the restroom, and I like had stood up, and I just, like, my vision started going black. I started losing some of my hearing. My legs got weak, and I just felt like I was gonna throw up. I was like, what is happening? So I pulled the little emergency red cord thing. Didn't think I would ever pull one of those in my life, but here we are. And I like said over the speaker, I was like, I'm either about to throw up or pass out. I don't know which one. So like the nurses, started coming to the bathroom, and of course I'm a normal human being, so I locked the door, because like who doesn't lock the door when you're going to the restroom? But so of course they had to get a key to try and get in, and I was like, oh, I locked the door, I gotta open it for them. So as I'm literally about to collapse on the ground because I can't hardly see, and my legs just aren't moving like they should be, I was able to manage to get my way over to the door and open it for them. And I just remember the nurses like telling me that my face was like super pale, and I did not look well whatsoever. I thankfully didn't actually pass out, but I came very close to it. I remember the nurse having to like hold me against the wall because it was bad. My whole thought process during all that though was, please don't throw up on her, please don't throw up on her. Thankfully I didn't. But anyway, they got me back to the room, took my vitals, and everything was fine. So I don't know, laying down just kind of got my blood pressure and heart rate back to where it should be. I don't know exactly what caused me to almost pass out, but it wasn't a great feeling. And the same exact feeling happened after my Maytherner stent procedure. Same thing. I was standing up the day after, trying to move around more because of just trying to recover better. And I had, again, vision started going dark, started losing hearing, my legs get all wobbly, made it to the toilet because I thought I was gonna throw up. I called over my stepmom. I was like, I'm either about to throw up or pass out, because the two feelings are like super similar for some reason. And thankfully neither happened, but I do remember feeling like I was about to just give in and just pass out, but I was like just trying to hold on because I didn't want to. And so again, thankfully neither happened. And then eventually I got back up, laid down, got some more fluids in me. And yeah, so that was that. So that's, POTS, orthostatic hypotension. Again, not really sure which one I have, but it definitely makes life a little bit more interesting. Again, people have it a lot worse than I do. So for me right now, the two medications that I'm on to help manage it, I was started out on fludrocortisone. I think it's like 0.1 milligrams, something like that. And that's supposed to help me like keep in more fluids, I think. I don't really know for sure, but I take it and it helps a little bit. So yeah. So I noticed after starting to take that, my heart rate went from about 140, 150 when standing to about 120. So it dropped a little bit, still not exactly where it should be. But then as of recently, I had another heart monitor, and my cardiologist noticed that my heart rate was definitely higher than it should be. I was getting a lot of heart palpitations, and so then I was put on propranolol. I probably didn't say that right, but some kind of beta blocker. Can be used for a lot of different issues, like stage fright and whatever, but it's supposed to help heart palpitations and heart racing, all that kind of stuff. And so far I've only been on it for a few days, and I noticed the other day I stood up and my heart rate was 80, which is a miracle. So hopefully I don't have to be on it for super long, but so far it looks like it's helping. I have noticed that it's definitely caused some nausea. So nothing some Zofran can't help. That's what happens when you take different medications. You might get all the different side effects from it. So, but either way, it's helping my heart rate stay down, closer to where it should be now, so hopefully it stays like that. But I know these medications don't always help, you know, people with POTS or orthostatic hypotension. Medications vary from person to person, so, you know, maybe if you're not on something for your POTS, maybe talk to your cardiologist about it, see what they think. Maybe they have a better recommendation for a different medication, or maybe you can manage it with fluids or compression socks, because those two are also very big. But yeah, just definitely talk to your cardiologist about it if you don't already have a cardiologist, or even primary care. Just talk to someone about it, because you definitely want to get this condition under control. So yeah, thank you all for listening to, you know, my rant on POTS and orthostatic hypotension. Hopefully someone learned something, or it helps someone, I don't know, but I appreciate you all listening, and I think we'll go ahead and move on now to gastroparesis in the next video. So again, thank you all for watching, and I will see you all in the next video.